Hi, I'm Zoya Brar. I'm the founder of Diagnostics. So the best way to understand the economic value of high-end diagnostics is to think about a quantitative factoid, which is that as we sit today, diagnostics is only 3% of all healthcare expenditure, and yet 75% of all treatment outcomes and the treatment expenses depend upon the initial diagnostic. That's crazy to me. When you go to high-end diagnostics, that impact is even more pronounced, or should I say more high-end. I'll give you an example. So let's take the example of non-small cell lung carcinoma. In that particular type of cancer, let's take a specific patient who has that type of cancer. If you were to do a specific high-end diagnostic test for this patient, that would allow for three different ways I would say that the economic outcome would be determined. Number one, it would allow this specific patient to choose a third line therapy right at the start. So instead of going to first line, second line, and then third line, this patient could go to the third line therapy directly if it works for them. And in doing so, of course, the entire expense of failed treatment would be avoided, which, by the way, is quite large in cancer. It's not insignificant at all. Second, this would allow that specific patient to possibly choose immunotherapy, which is an extremely expensive choice, $100,000 per patient on an average. And so if it isn't given to the right patient at the right time, it could, of course, have dire consequences, but economically it could be quite disastrous. Third, whilst actually the first two have a direct dollar value attached to them and you can really quantify it, the third is harder to quantify, but is still extremely critical, which is the quality of life of the patient. Now, if the initial diagnostic allows you to pick the right treatment, the quality of life improves significantly for that patient. And there is a direct impact on both productivity as well as, time spent of caregivers and the patient themselves on treatment. And hence, you can compute from there that there is a direct economic value to the testing done in the beginning. And if you just look at this globally, there's a huge amount of money that's spent on oncology treatment, $200 billion globally. And I believe at least 25% of that could be reduced, so about $50 billion, if the right test was done or the right high-end diagnostic test was done in the start. Now let's take another example, which is, I guess, a different vector of diagnostic testing, so early detection. Pick something like a non-invasive prenatal test, which is done for pregnant women, when they've conceived the baby, and as we know today, a lot of women are working and professionally more successful, and that's making families choose to have babies later in life. And there's a definite genetic risk that increases if women get pregnant later. And to detect that, you can either choose to detect that later in the pregnancy or earlier. And the earlier you detect it, the lesser the consequences in terms of treatment and healthcare expenditure. So that again is a test that allows you to do it quite early in the pregnancy and hence reduces economic burden. Another example is infectious diseases, right? Let's take the example of an oncoming sepsis. The difference between preventing it or treating it is typically 10x. So treating a sepsis costs about 10x more than if you just prevented it. And it's not just cost. Often it can mean the difference between life and death, because a sepsis caught too late is typically a death sentence. Another example is diseases that affect both the body and the mind, so dementia, Parkinson's, etc. These again would really significantly benefit from early detection using a high-end diagnostic test. Often, again, the early detection would allow that this patient has an option for treatment as opposed to simply living with the progression of the disease. So the examples are plenty where high-end diagnostic testing directly has an economic value on the downstream treatment, because it allows for precision therapy to happen. So it allows you to select for a specific patient the right drug, the right treatment, the right dose at the right time that would work for them, and hence ensures that we spend only the adequate amount of resources in the right place. As the adage goes, a stitch in time saves nine, and I think it applies quite precisely to this question.